Good morning and welcome to ABC News Ghana. This is ABC Headlines. I am Khadija Isifu. Coming up in the headlines. Beginning next year, consumers are set to pay an additional 15.9% for water and 9.8% for electricity, according to the latest adjustments by the Public Utilities Regulatory Commission. Health Minister ABENA Mante has given newly posted medical doctors an additional week to report to their duty stations following what he described as an alarming nationwide refusal to take up postings. We have these and many more coming up. Do stay tuned. We are streaming live on Facebook and on YouTube at ABC News GH_. Now to the details. The Public Utilities Regulatory Commission has announced upward adjustment to electricity and water tariffs following the completion of a 2026-2030 multi-year tariff review. The new rates take effect from January 1, 2026. According to the PURC in a statement, the tariff decision follows months of investment hearings, stakeholder consultations, and regional public forums held across the country as part of the regulatory process. According to the PURC, electricity tariffs for all customer categories will rise by 9.86%. The Commission says the adjustment reflects the investment needs of power utilities, expected generation input, and macroeconomic indicators such as inflation, the cedi-US dollar exchange rate, and the cost of natural gas. Water tariffs will increase by 15.92% over the 2026-2030 period. The adjustment, according to the PURC, is based on projected production and sales volumes, non-revenue water levels, expected capital investment requirements, and prevailing macroeconomic conditions. The review also covered operational expenses and the regulated asset base of utilities for the next 5 years. In related stories, the management of Ghana Water Limited, Accra West Region, has announced a temporary shutdown of water production at the water treatment plant to allow for urgent repair works on a major faulty pipeline. In a statement issued on Tuesday, December 2, the company explained that one of the key pipelines transporting treated water from the plant to western part of Accra has developed severe perforations. Officials warned that the line could completely give way if immediate repair work is not carried out, necessitating the scheduled shutdown. According to GWL, the interruptions will take place on Thursday, December 4, 2025, from 6 a.m. to 6 p.m. The 12-hour repair window is expected to affect several densely populated communities. Areas to experience water supply disruptions include Kolebu, Dansuman, Mamprobi, parts of Weja, Bawe, Malam, Anya, Kwashiman, Ablekuma, Dakuman, Kaneshi, Tesano, Odoko, Soltuom, La Paz, parts of Achimota, the North Industrial Area, and adjoining communities. WL assured the public that water production will resume immediately after the repair works are completed. Now, away from that, the Technical University Senior Administrators Association of Ghana has declared an indefinite nationwide industrial strike set to commence on Wednesday, December 3, 2025. The action follows what the association terms as a blatant breach of agreement by the government concerning the payment of a negotiated one-time research allowance that has been outstanding for nearly 17 months. The strike will result in the complete withdrawal of administrative services across all 10 technical universities, immediately stalling essential functions critical to the running of the academic year, including admissions, examinations, and finance. The core of the industrial action stems from the government's persistent failure to disburse the allowance which TUSAG members were expecting following an agreement reached on July 10, 2024. According to TUSAG, the allowance is not a discretionary bonus, but a contractual obligation. The continued non-payment, the association says, constitutes to be a blatant breach of agreement and demonstrates a lack of respect for the essential contributions of administrators to tertiary education in Ghana. Healthcare delivery in the Upper West region is facing a severe crisis after an alarming number of newly posted medical doctors refused to report for duty. The Regional Health Administration confirmed that 25 out of 32 doctors allocated to the region for the 2025-2026 service period have failed to accept their postings, leaving a huge gap in the medical workforce. The Upper West Regional Director of Health Services, Dr. Josephat Nuzal, expressed deep worry over the refusal, warning that the immediate shortfall will have a huge negative impact on the quality of healthcare available to the region's nearly 1 million inhabitants. The refusal rate, which accounts for over 78% of the allocated slots, intensifies the existing pressure on the region's limited healthcare personnel. This ratio means that, on average, each doctor is responsible for the health needs of approximately 18,181 people, a ratio far exceeding the World Health Organization's recommended standard for effective primary care. The new allocation was intended to significantly alleviate this burden, but the mass refusal has exacerbated the situation. Dr. Nuzal disclosed that the region was allocated 32 slots for doctors to apply for postings, highlighting the high expectation that this intake would bridge critical staffing gaps across district and municipal health facilities. Meanwhile, the Minister of Health, ABENA Mante, has expressed concern over the refusal of newly posted doctors to report to their duty stations and has given them 1 additional week to do so. Mr. Akando confirmed that initial reporting rates are not encouraging, with data indicating a national crisis where 7 out of every 10 doctors posted to assigned regions have not reported. The minister's statement comes amid alarming figures showing that regions in critical need of personnel, such as the Upper West and Upper East, recorded 0 reported cases as of last Friday.
From the update that regions like Upper West and Upper East are recording 0 as at Friday, we will give them additional 1 week to appeal to them to report to their various facilities where they have been posted, after which we will do what we call validation. Unfortunately, there's no way we are going to change anything here, unfortunately. And so we will give them 1 more week to report to their various health facilities, whilst we are also engaging the stakeholders in their respective districts, regional ministers, members of parliament, DCs, chiefs, to facilitate their stay in their district to be able to give up their best. We have started that myself, engaging them. And so government will also look at how we can incentivize them to give up their best in these districts where they have been posted. Doctors we have in this country in Greater Accra alone. Nearly 50%. It's not scary. So at this point, government has taken a decision. And look, let's post these medical officers to where their services are needed most.
Still in health, the United Nations government has announced a commitment of up to $150 million to Zipline International to expand access to life-saving medical supplies, including blood, vaccines, and essential medicines to as many as 15,000 health facilities across Cote d'Ivoire, Ghana, Kenya, Nigeria, and Rwanda. This was announced in a U.S. Embassy digital press briefing on Tuesday, December 2. The support forms part of the U.S. Department of State's New America First Global Health Strategy, which aims to increase value for U.S. taxpayers by reducing waste, eliminating dependency, and ensuring development assistance aligns with U.S. foreign policy priorities. According to Jeff Graham of the U.S. Department of State, the strategy strongly emphasizes delivering critical medical products to populations in remote and underserved areas. He said partnering with Zipline, an American robotics and drone technology company, is central to modernizing the U.S. approach to global health. Under the agreements of the U.S. will support the expansion of Zipline's American-made advanced robotics to address slow and unreliable logistics challenges that prevent timely access to essential health supplies in rural communities. Away from health, a Tuesday morning fire has ravaged a room in one of the boys' dormitories at Kejebi Asoto Senior High School in the Oti region, leaving several students collapsing from exhaustion as they attempted to salvage what they called the blaze, which reportedly started around 9 a.m. on Tuesday, December 2, swept through the dormitory room, destroying all belongings and the roofing structure. By the time the flames were contained, nothing in the affected room could be saved. According to reports, efforts by the Ghana National Fire Service were severely constrained as personnel who responded to the distress call were unable to deploy an operational fire tender. The appliance in the Kejebi district is currently out of commission, leaving firefighters to rely on limited alternative methods to manage the situation. The incident caused panic among students, with dozens passing out from fatigue and anxiety as they try to assist in controlling the fire and evacuating personal items from nearby rooms. School authorities and community members worked together to stabilize the affected students, who have since been attended to. That's how we wrap up with the headlines this morning. For more news, visit our website at www.abcnewsgh.com and follow us on our socials at abcnewsgh_. ABC in the morning comes up next with ABENA MANTE. I am Khadija Isifu. Have a nice day.